Mr. President, on Thursday, after 2 additional weeks of consultation and input from senators, we released an improved version of a bill we call the Better Care Reconciliation Act, which represents our efforts to address the failing status quo of Obamacare. We've said all along that even if Hillary Clinton were elected president, we would have to revisit Obamacare because we've seen in a number of states that insurance companies are fleeing, leaving people with few, if any, options. People in the individual and small group market are seeing their premiums skyrocket, 105% nationwide since 2013 alone, 105% increase in premiums. And for many of these folks, even though they pay the higher additional premium, their deductibles are so high they effectively are being denied the benefit of any insurance whatsoever. And so I guess perhaps it's no surprise that 28 million Americans would simply be willing to pay the fine that goes along with the individual mandate for not buying government-approved health insurance or claim some sort of hardship exemption. So while Obamacare was sold under the premise that if you like your policy, you can keep your policy, if you like your doctor, you can keep your doctor, and oh, by the way, your premiums are going to go down $2,500, what people have experienced has been the opposite of that, with premiums going up on average $3,000. So we simply believe that we have to act to save the millions of people who are being hurt by the status quo. And that would be true whether Hillary Clinton were president or Donald Trump were president. So our first goal in the Better Care Reconciliation Act is to stabilize the insurance markets, to make sure that people actually have an insurance company that they can buy from. Our second goal is to get premiums down. The reason premiums are down are mainly twofold. One is that you have younger, healthier people simply foregoing insurance, leaving only sicker, older people in the risk pools and under adverse selection. That means everybody pays higher premiums when younger, healthier people simply don't purchase the product because they can't be part of that risk pool. The second reason why premiums are so high is the mandates. People simply being ordered by their own government to buy coverage that they don't want or need, which drives up premiums, not to mention the fact that young people are subsidizing older people's health insurance premiums the way that Obamacare was constructed. So we're going to do everything we can to get the premiums down. And with the first Congressional Budget Office report, it said that long-term you would see premiums go down as much as 30% by the year 2020. But we want to do even better than that if we can. The third thing we said we wanted to do is we wanted to protect people with pre-existing conditions. You know, when people are forced to keep a job that they really don't want because they don't want to lose their employer-provided health coverage due to pre-existing conditions, we don't want people to be stuck at a job they don't want or be unable to quit their job and look for something else because they're worried about not being covered due to pre-existing condition exclusions. So we maintain the current status of the law with regard to protecting people from pre-existing conditions. And then the fourth thing that we try to do in this bill is we try to take one of the large entitlement programs, Medicaid, which is an important safety net to low-income Americans, and to put it on a sustainable path. Now, there's some people that think you can spend hundreds of billions of dollars more for Medicaid over time, and we can continue to deliver those services to the poor people in our country, and we don't need to worry about crowding out defense spending or education or some other priority. We simply cannot do it. And so what we've done is put it on a responsible growth rate and delegate more of that authority to the states to come up with innovative programs. So our plan will remove costly mandates. It'll help provide more options and drive down some of the exorbitant costs. We will soon have a chance to rescue the American people from the failures of the Obamacare experiment. This is a critical moment for the Senate. I want to go over a few updates to the discussion draft, perhaps in hopes that some of my colleagues on both sides of the aisle will realize that when faced with the choice of our reform plan or the status quo, that the choice is clear. So after listening to a number of senators, we made some important updates. For example, to combat the opioid epidemic that's ravaging the country, our new draft includes an additional $45 billion for substance abuse and recovery. As this chart indicates, the number of people with HIV has gone down to 6,400, thanks to innovations in drug therapy, principally. Car accidents, 37,000 people die a year in the United States as a result of car accidents, but 52,000 and growing number of people lose their lives due to opioid and other drug overdoses. This is an epidemic that has to be dealt with. The abuse of heroin and prescription painkillers is devastating families and communities all across the country, but particularly we hear from our colleagues in Ohio and West Virginia and Kentucky that this is an urgent and unmet need. These additional resources will be critical for providers, for advocates, and for families on the front lines of this crisis. As I said, our colleagues from Ohio and West Virginia and in New Hampshire and other places advocated for something called the Comprehensive Addiction and Recovery Act last year, which we were able to pass to address this crisis. We passed additional legislation called the 21st Century Cures Act in December, which again added additional resources. But this represents the single largest allocation or appropriation of federal dollars to deal with this crisis that's ever occurred before. And I think it's because it's necessary. And I thank our colleagues for bringing this to our attention. This is a shocking statistic when you think about it, that more people die of drug overdoses in America today than die in car accidents. And we're going to do something about that in this legislation. We're also introducing a provision that would, for the first time, allow people to use pre-tax dollars to pay for their insurance premiums. Let's say you pay 25% of your income to taxes. Well, if you can use pre-tax dollars, then basically that effectively lowers your out-of-pocket cost if you can use pre-tax dollars rather than net of tax. And so we expand the use of health savings accounts to give people that ability, which effectively lowers the cost of their premiums again, and provides them more flexibility in terms of determining how to provide for their health care. Some people may decide, and we want to give them the freedom to do so, to say, well, maybe all I need is a hospitalization policy, in addition to a health savings account where I'll put pre-tax dollars in there and save them and use those to pay for doctor's visits. That's the kind of thing that I believe we've seen in states like Indiana and elsewhere that have been used very effectively to provide additional choices for consumers and their physicians on how they address their health care needs and their costs. So as I say, allowing consumers to use pre-tax dollars to pay for their health insurance premiums will help bridge the coverage gap. Both the Congressional Budget Office and the Joint Committee on Taxation have affirmed this will help boost access to health care coverage. Another improvement this latest discussion draft brings forward is more options to buy lower premium plans. Under the Better Care Act, anyone in the individual market is allowed to purchase a lower premium health insurance plan, like the one I mentioned. While those plans have lower monthly costs with a higher deductible, they'll still cover up to 3 primary care visits a year and ultimately limit an individual's out-of-pocket costs. And coupled together with the health savings account, this may well be the most affordable way for people to address their health care. Not everybody's the same. That was part of the problem with Obamacare. It treated us all like we were widgets and not human beings with unique needs, depending on our family circumstances, our health condition, or what part of the country we lived in. This allows people to personalize and individualize their own health care plan. I think this is great news for otherwise healthy adults previously barred from purchasing these plans under Obamacare. Young people who we need in the insurance pool in order to bring down premiums for everybody else. These younger people don't want to have to subsidize older folks' health coverage. They want to pay the freight for their own costs, but this will allow them access to a lower cost plan that will allow them to be covered for an unexpected hospitalization or other catastrophic event. In addition to this freedom of choice, these plans will now also be eligible for tax credits. In other words, what we provide is a refundable tax credit, which essentially is a check from the federal government to the insurance company to pay your health insurance premium. But under Obamacare, people enrolled in these sort of catastrophic plans were prohibited from receiving tax credits like the ones we're offering, even when they met all other eligibility requirements. That doesn't make any sense, and our legislation fixes that. We've also made several revisions to Medicaid. I might just mention, Mr. President, there's a lot of discussion about whether we are cutting Medicaid. And I've said before, only in Washington, D.C. can you spend more money year after year and be accused of cutting. Honestly, fairly, what we do is reduce the rate of growth for Medicaid, this uncapped entitlement program that's contributed to more than $20 trillion in national debt. We put it on a reasonable budget and a rate of growth. And actually, from the beginning till the end, we'll see Medicaid spending go up by the federal government, $71 billion. But ultimately, for Medicaid to work more efficiently for the people it's intended to serve, primarily the children, the blind, the disabled, the elderly, frail, we need to give the states more flexibility to implement Medicaid spending based upon the unique needs of people in their states. One of the big problems with Obamacare is it expanded Medicaid to otherwise healthy adults. We've got a better way to deal with that using the tax credit, the state innovation and stability funds, and something called the 1332 waivers, where the Center for Medicare and Medicaid Services essentially is giving the states the opportunity to innovate and use the money in the tax credit to come up with something that suits the needs of their population. And really what we need to do is get Medicaid back focused on the most vulnerable population, which are the disabled, the blind, the elderly, frail elderly, and children. To improve the management of vulnerable populations such as this, now states can apply for a waiver to utilize existing funds as they see fit to improve community-based services that these folks rely on. Our Medicaid provisions allow the states flexibility to route funds to regions impacted by public health emergencies, which includes disastrous weather events like hurricanes. So instead of being applied as a block grant or based on per capita caps, under our legislation, emergency funding will be applied where and when it's needed. And lastly, under our Medicaid revision, states can add expansion populations under existing block grants if they choose to do so. But Medicaid will always be, as it has been, a federal-state shared expense. But by allowing states to be flexible in their Medicaid application, we can help them fill the gaps that the mandates under Obamacare chose to merely gloss over. So, for example, in Texas, we were not a Medicaid expansion state, so young adults between 100% of poverty and 138% of poverty will now get access to a tax credit, the Innovation and Stability Funds, and these waivers, which will allow them for the first time to get access to private health insurance. That's good for them, and I think represents a vast improvement over the status quo, about 600,000 in Texas alone. Our new draft includes an additional $70 billion to encourage states and help them implement these new reforms. You know, really what I have come to learn is that people don't really trust Washington, D.C., and certainly based on the experience of Obamacare, this failed experiment where people were promised certain things that ended up not being true and creating the problems that now we're having to fix. I think people will have a lot more confidence in a plan that lets the governors and lets state leaders manage this money and address the health care needs of their population in a way for people who are closest to those people rather than here out of Washington, D.C. And our bill does that in a dramatic way. It takes that authority and power grabbed by Obamacare and gives it back to the governors and the states to manage. And based on the polling I've seen, people certainly have greater confidence in the states and their leadership at the local level to deal with this than they do under Obamacare. So if governors want to try to come up with unique health care products to drive down premiums through cost sharing or increase funding for health savings accounts, this legislation gives them greater flexibility, and it gives them additional funding through the Innovation and Stability Fund to do just that. Many of us have quoted Louis Brandeis, who served on the United States Supreme Court, who famously said that the states are the laboratories of democracy. And it's true. You don't see any innovation at the federal level. It's more like dealing with the Politburo. It's all command and control. It's central planning, which we know doesn't work very well. But the states are the laboratories of democracy, and if we give them the freedom to innovate and the resources to do so, I think we can expect our health care system to move forward. Soon we're going to have a critical vote, one that's been 7 years in the making. And while our plan is not perfect, it is certainly better than the status quo, which is why we call it the Better Care Act. This is not the end, as Dr. Tom Price of Health and Human Services points out. This is just the next step. We know we're going to have other opportunities to address health care, and most notably in September when we reauthorize the Children's Health Insurance Program. But this, by any measure, represents an improvement over the status quo, and I think there are some very useful parts of this bill that people will like if they look at it objectively and consider it fairly. But if we don't take up the bill, well, it can't be changed, and millions of Americans will continue to be harmed by the status quo. So that's a decision that all of us are going to have to make when we move to the bill. Do we have enough confidence that we can make it better, or are we simply going to throw our hands up and say, well, I give up before we even start, leaving people with the failure of the status quo? So I'd like to encourage our colleagues to work with us to make this legislation better. It's unfortunate that health care has become such a polarizing and partisan issue. It doesn't need to be that way. But it started off with Obamacare, which was passed with along purely party lines, creating a situation where there's not bipartisan support for health care generally, which is a real tragedy given the importance this has to all of us and all of our families. But given the hand we've been dealt with, we're going to plow ahead and do the best we can. And Mr. President, I sat down at my computer this morning and I started to write a list of things I like about the Better Care Act that perhaps most people haven't heard much about. Number one, it repeals the individual mandate. This is the fine that's been imposed on people for not buying government-approved health insurance. It repeals the job-killing employer mandate. This bill will lower premiums repeal burdensome taxes, and restore choices. It will help stabilize insurance markets and protect people from pre-existing conditions. It'll allow people to use pre-tax dollars to pay their health care costs, including insurance premiums. And it provides substantial resources to fight opioid and other substance abuse. It provides better quality coverage to low-income Americans that will improve medical outcomes for low-income Americans. And it puts Medicaid on a sustainable path. So, Mr. President, I'd like to encourage all of our colleagues to work with us to help make this legislation even stronger. Everybody will be able to offer an amendment and get a vote on the amendment when this bill comes to the floor, because I believe the alternative is a disaster for our country, and we simply can't afford to let it stand.